and welcome back to the Morning Blend. This is Insurance 101 with Sovereign Select. Today, our focus is on figuring out what Medicare options are best for you. Our next guests know it can be difficult to sort it all out, and they hope to take away the stress. Deb and Jerry Dornbush are with Silver Supplement Solutions. They're authorized agents with Sovereign Select. Good morning to you both.
Hi, Molly.
Good morning,
Good
Molly.
to see you.
Thanks for having us
Good to
back.
see you. Yeah, Happy New Year to you guys.
Happy New Year to you.
So
Same to
here's
you.
the deal. With healthcare decisions for me at work, I'm always kind of stressed out about it. I actually dread the enrollment periods and making those choices and looking everything over. That's why I think it's such a beautiful thing that people have the two of you to hold their hand, because Medicare, people are overwhelmed with information.
Correct. With everything going on in the world, there's enough stress out there, let alone to worry about healthcare decisions. But life goes on, so you do have to make healthcare decisions, and that's what we help with. We walk people through things. We educate them on what the parts of Medicare are, and just hold their hand as we walk them through the process.
I think that is so sweet and so important. And I'd love for you to describe how you do that, how you walk people virtually, holding their hand through this process.
Well, Molly, first we start with our education. We do free Medicare education classes, Road to Medicare, et cetera. And we do them in person. We can do them over the phone, or we can do them Google or Zoom. And what we like to do is go over things slowly. People can ask questions along the way. And we just break it down for people into very easy to understand language and terms, explaining the difference between the different plans, and the parts of Medicare, A, B, C, and D. And from there, we feel like they are able to make an educated decision. And we feel confident in that when somebody has the education and they understand what they're getting into. It's really helpful for everybody on each side.
And then, Jerry, the next step is gathering information so you can assess, right?
Correct. Everybody's situation is different. No two people have this exact identical situation going on in their lives. Some may never see a doctor, have no medications. Others may have a ton of medications, have a whole list of doctors that they see. Some may have some special health issues that are going on that need to be looked at. And the options are different for each of those situations. They don't match up. One plan is good for everybody. It's very much an individualized thing. So we gather what their doctors are, what their medications are. Do they plan on traveling? Are they snowbirds? Because all of that goes into the decision on what plan would be the best for them.
And then, Deb, the idea is that you then present them with the best options for them after getting all that information.
Right. Well, we like our clients to make their own decision. We offer recommendations, et cetera, but after we give them all the information, I mean, it's kind of difficult to understand at times, because even with the drug plans, they may affect this donut hole that everybody's afraid of. So we do all the math and all the figurations. We give that information to our clients. They can ask questions, and then they make up the decision themselves. And what we do is just kind of explain to them, once they've chosen something, how good it'll be for their situation. So it's very enjoyable to be able to help people. And we've now been helping people really save a lot of money, especially last year. So that's great.
It's wonderful. And do you find that most people really appreciate the education part of it, so that they can feel like not just that you're making a great recommendation, but they're part of the process and that they understand what their options are?
Yes, they've been very receptive to it. It's amazing that we all grew up with not worrying about health insurance. We just got it from our employer, never paid attention to what it actually was and all the different parts of it. And how they work and what it costs. But as they get older, they appreciate the education to figure out what's the best plan for them.
And I know that the more information people have, the better the decision that they make. And then it's something that you're willing to review on an annual basis. So people are always getting a plan that's customized for them.
Correct. Every year they have the chance to change their plan during annual enrollment period that we just got through. And there's also times during the year where there's special elections. If their financial situation changes, if they get Medicaid, then they're eligible for special plans. If they lose Medicaid, then they have to go on to the other plans. It's an ongoing process.
It's so great to see both of you looking healthy and well. Happy New Year to you, and thank you so much for joining us.
Happy New Year to you. Thank you.
Thanks so much.
Yeah, thanks so much. The more information that you have regarding Medicare, the easier it will be to make an educated decision for your health care. So join the Dornbushes for their Road to Medicare educational events. They are having two of them on Friday, January 22nd. One is at 10 a.m., the other is at 6 p.m. You can register for those virtual events or get your no-cost consultation by calling their office. Here's the phone number. It's 262-728-9311. You can also check out their website for more information. That is silversup.com.